There's things that you enjoy, there's things that you're good at, and there's things that the world is ready to pay you for, right? Find out where all three meet, and you'll be a happy chappy forever, right?
Hey guys, welcome to the CPD Junkie podcast, where we bring you interviews with dentists sharing their CPD stories and journeys from around Australia. I'm your host, Laurence Doan, and today we're joined by Dr Rizwan Ahmed. He got his BDS in India in 2009 and is very passionate about his calling. He has been actively involved in postgraduate education ever since, as a student and as a mentor with special focus on early intervention orthodontics, chronic head and neck pain, dental and muscular, and cosmetic dentistry. Dr. Riz Ahmed, welcome to the show.
Thank you for having me over.
So, tell us about your CPD or dental journey so far.
So, because I was a dental assistant for a very long time before I got my dental license, I worked with some really, really good dentists in Sydney, right? Sydney and in Western Australia as well. And I saw what they did. So I knew even before I started practicing that there was a lot more to dentistry than what we learn at uni. I saw them get really involved with TMD, orthodontics, do some really complex treatment. And I didn't want to be your bread and butter dentist, right? There's so much I wanted to learn. The first thing I did as soon as I got my license was surgical extractions, of course, right? So the same course that a lot of your previous guests have done, the whole Cambodia, Malaysia thing, which obviously isn't quite popular now because of the whole refund issue. So I did that, and that institute, we won't name any names here, of course, but then that institute might have a bad reputation for payments, and the management side of things might have dropped, but the clinical mentors they have are still excellent, right? So surgical extractions was the first one. Then, because I've had a lot of chronic head and neck pain issues myself, migraines, the whole works. I did a 3-month fellowship with Steve Olmos back when he could visit Australia. I then, obviously orthodontics, aligners, a little bit of myobrace, the comprehensive didnt orthodontic course, also done their pain management course and all that. And right now I'm mostly focused on cosmetic, so aesthetic and restorative dentistry with Chris Ho.
Yeah. Well, let's bring it back a little touch. So you're a dentist, you're observing a lot of different dentists kind of doing, like you said, quite complex kind of treatment. And so that kind of inspires you to kind of want to kind of get into that space. But you when you came out and graduated, well, not graduated, but accredited, you decided you wanted to go into surgical extractions first. Why is that?
Most patients, when they come to you, right, they judge you on basic skills. They don't judge you on your complex treatment plans. They don't judge you on your pretty composite work or porcelain work or a nice prep with the perfect margins, right? To them, if you're a dentist who can't pull a tooth out, you're a terrible dentist. So that was one area I wanted to get confident in. And also, that's one area where if you get stuck, it's really hard to get someone to bail you out unless you've got someone standing right behind you, right? So being bad at extractions would be very, very embarrassing.
So that was something that you kind of knew, and then how did you kind of come about these particular courses? Was it through word of mouth, or was it from something you were seeing online, or?
Our dental forums have been very, very helpful. So the surgical course, of course, was mostly through dental forums. Most of the courses I did after that was through personal recommendations. But the first surgical course I did was something I came across just on DPR.
Right. So after you did through the surgical side of things, you dived into, was it?
Orthodontics.
Oh yeah, orthodontics, yeah. So tell us about how you explored that path.
Now, orthodontics has always been something I was interested in because I saw a lot of my mentors do orthodontic treatment. And then I spoke with Rob Lynn in Brisbane, who obviously has done a whole bunch of orthodontic courses. I spoke with some other mentors. They recommended either EODO or IA-Dent, so Derek Mahoney or Ken Lee. I ended up with Ken Lee, and that was quite enlightening because it's not just orthodontics that, the way these guys approach orthodontics, they can change your entire treatment planning philosophy. So that was quite helpful because there's something that's quite cliched and it's quite controversial as well, but then sleep, chronic pain, and orthodontics are three heads of the same monster. So that's something I learned over and over again, and that was quite helpful.
Mm-hmm. Yeah, so tell me about that. What do you mean by it's like the three heads of the same monster?
So people who believe in it completely believe in it. People who haven't yet had that education can be skeptical about it. But if you think about it, craniofacial growth is craniofacial growth, right? Uh, Now, if there's cranial distortions, if your maxilla and mandible isn't where it's supposed to be, if you've got a strong underbite, then obviously your airway is compromised. If your airway is compromised, then obviously you're not sleeping well. In most cases, there's other factors that impact your sleep, of course. But then if you have those things, it's all tied together, right? Now, once again, if you have a significant cant, then it stands to reason that in 9 out of 10 cases, you'll have more pressure across one TMJ than on the other, right? And if you've got more pressure across one TMJ, then you're more likely to have a dislocated disc, a deranged disc, more likely to have chronic pain.
Fair enough. And
Parafunction, yeah, sorry, go on.
No. I was just gonna say, continue first. Continue first.
So parafunction, bruxism, of course, there's the whole biopsychosocial model, but then sleep, craniofacial growth, and myofunctional factors are a key factor in the whole equation as well.
And so that's what you kind of realized after going through that course. Is that right? After going in through orthodontic kind of courses, you kind of realized this is what I really didn't quite understand when I was maybe as a DA looking out from the inside.
That's right. And most undergraduate programs, most dental programs don't quite cover any of these things either, right?
Yeah. So, I mean, how did you decide to go with this one in particular? Because for a lot of graduates now, there's so many different orthodontic courses out there, you know? And how did you decide that you were going to go with this one in particular?
So there are a lot of courses out there, and they're all good, right? And all of them add a little more to the knowledge that you already have. And this is consistent with what Jeff mentioned in his chat with you too, right? With IA Dent, I picked that because Rob was one of my dentists when I was managing practices for Bupa. And I could see that he's a really good clinician. He knows what he's talking about. He was one of the first CPD junkies who really spent a small fortune on CPD each year. And yeah, I took his recommendation, and then recommendations from some of my mentors, Dr. George Lee, Dr. Andrew Lee in Sydney. They've done all of these courses themselves. And yeah, it was mostly through personal recommendations.
Yeah. And so after you complete this orthodontics, how did you feel? Did you feel like you felt compelled to do more orthodontic courses CPD, or was it time to kind of dive into some of the other different courses that you were interested in?
A bit of both, right? So the most recent course, orthodontic course that I did was with Simon Wong in Melbourne. And what he likes to say is, you don't just dabble in orthodontics. Orthodontics cannot be your hobby. So no single course is enough. You need to keep studying. And as a GP who gets into orthodontics, it's a high litigation area as well. So you really need to keep on top of that, right? So I've done some more orthodontic CPD after that. But then I also wanted to improve my restorative skills, because the idea for me was always to be a cosmetic dentist, right? And cosmetics would involve orthodontics, restoratives, and hopefully at some stage, soft tissue grafting as well.
Right. So that's where you're kind of going and seeing how things... I mean, you mentioned your bio, it's more about early intervention. So talk to me about that.
So early intervention, once again, now traditionally, we've all been taught at uni to monitor a patient that orthodontics shouldn't start or doesn't start or cannot start until you got all your adult teeth, right? And a lot of patients will say this as well, because this has been hammered into them over and over and over again. But my child doesn't even have all his or her adult teeth. And once again, now what I'm going to say next is quite controversial. Some literature shows that there is absolutely no link between alignment of the deciduous dentition and alignment of the permanent dentition, which might be true. But then there's also literature that shows, and also common sense, that if someone's got a severely undersized maxilla or mandible, or if someone's got a severe class 3 or a severe class 2, or a retrusive mandible or a bimaxillary retrusion, which is quite common these days, that's not going to fix itself. If a child is already lagging behind in their growth at the age of 6 or 7, They're not suddenly going to have a massive growth spurt and, get Chris Hemsworth cheekbones and a jawline by the time they're 13 or 14, right? So early intervention, fixing what epigenetics messed up for you. Now, of course, with orthodontics, there's genetics and epigenetics. And the two massive schools of thought with orthodontics are genes are everything. You got messed up genes, you will have braces. And then there's also epigenetics, right? Your environment does contribute to how you grow. And that's something we can fix with early intervention orthodontics or orthotropics or forwardontics. These are different terms that different specialists and different gurus use across the world. But orthotropics, forwardontics, or early intervention orthodontics is something that can correct skeletal issues early on in life.
And that's kind of what dived you down the path of learning about myobrace, is that right? Or is it the other way around?
Myobrace was something that I attended on the side. Now, myobrace is controversial as well, of course. Myobrace is essentially, okay, I can't define myobrace because that could get us both into trouble. Okay, myobrace works where it works, right? So diagnosis is key. Myobrace is not a one-size-fits-all, even though that's what it's marketed as. Myobrace cannot be applied to every situation. However, as a habit correction appliance, it works quite well. So that was something I did on the side. So myofunctional therapy is massive, right? So myofunctional therapy is to myobrace what orthodontics is to Invisalign. Invisalign isn't all of orthodontics, but if you are into orthodontics, you would want to know what Invisalign or aligners are. Believe in myofunctional therapy, myobrace is one of the tools or part of your arsenal if you choose to make it so.
Interesting. Yeah, and that was something that you came to realize after when you were doing orthodontics. This is something that was dived into in the course that you were doing at the time. How did you come about, myofunctional? Because a lot of people
myofunctional, exactly, spot on. That's the perfect question, right? That question I can answer, right? So myofunctional therapy was something that was mentioned across most orthodontic courses that I've done, and so that is considered controversial. However, it's considered controversial because there's very little recent literature to support that. But if you open up your oldest orthodontic textbooks, right, Angle and all of that, every book mentions myofunctional therapy. The reason it's considered controversial is because some people believe that any treatment that's compliance-based is going to fail. But yeah, myofunctional therapy was touched upon all the courses that I've done. And an offshoot of myofunctional therapy is myobrace, and I looked into that.
Right, I follow what you're saying, yeah. And then is that how there was an also offshoot into sleep apnea and head and neck pain? Is that how that kind of interest developed?
Sleep apnea, head and neck pain are a key part of most advanced orthodontic, most comprehensive orthodontic courses these days as well, be it Derek Mahoney, be it Simon Wong, be it Kenneth Lee. And most of these people say this over and over. It's like sleep, pain, and orthodontics are three heads of the same monster. So if you have a properly grown skull, if you have a well-developed dentition, that's what Derek Mahoney calls his course, right? Full face orthodontics. So if you have a well-developed face, then you are significantly less likely to have all these issues.
Right, yes, I follow what you're saying. So that's how you kind of go into orthodontics. And now, whilst this is all happening, you're trying to aim for your cosmetic dentistry dream, which is why you kind of dive into more of the cosmetic side of things. So tell us about that. Where's that gone?
So that one, during the lockdown, of course, most of us saw some really nice photos of dental work from across the world. There was a lot of free CPD. There was a lot of, all of us had time to get into online lectures, Spear, Maxim Belograd, the whole works. And so I started some veneer cases and all that. But then, of course, the big masters, right? So all these prosthodontists, all these aesthetic gurus, there's Bharat Agarwal, there's Johan Choi, there's Chris Ho. They're all involved with the same faculty with the ACDP, and they were starting this course. And I was like, There's literally no better opportunity to get into aesthetics in Australia. Every single master that you've been following is on the faculty.
Mm-hmm. It's interesting that you mentioned that, for a lot of recent graduates at the time, yeah, they were definitely, on their phone more. They're scrolling through Instagram and they're seeing all this, and they're getting into this mindset of like, oh, all this comparison. How do I get to that kind of level? I mean, it's interesting that you yourself, you're saying as a more senior clinician, that you kind of went through that same kind of experience, but then that kind of didn't, I would say, hinder you, or it kind of compelled you or inspired you to take it to that next level and then to get into this diploma.
The thing is, we're all always students, right? Anyone who's not growing, anyone who's not learning, anyone who believes they're too good to learn anymore is probably getting outdated. That's what dentistry is, right? So when I was new to dentistry, I did believe that I would get to a point where I wouldn't have to study anymore, or where I'd know everything. But that's not possible. That's never possible.
Yeah, you end up, you realize after you do a 5-year degree, no, the study never stops. There's always more to learn. If you're not growing, you're dying.
Exactly. The biggest lesson you learn is you know very little. The more you study, you realize you don't know anything at all.
Yeah. So then you decide, you see all these Instagram people, but you also hear these great clinicians, and you're seeing their work as well. And they're starting this course, the ACDP, Aesthetic and Restorative Dentistry, and then you decide to sign up?
Absolutely. I applied for them. So they had a little bit of a screening process. They had applications and stuff. So I applied for the course. I was lucky I got in. And that was mostly it. Now, the whole pandemic situation did, muck our dates around a fair bit, starting dates and all that. But that's how I got in.
So how are you finding that course yourself?
These are mostly clinicians. These are all clinicians who not only are really good at their craft, but then they're really humble and approachable people as well, right? I mean, Chris in particular, despite all his qualifications, despite all his experience, still reads more literature than possibly anyone else I know, or anyone else in the industry for that matter, right? So that has been a very humbling experience. Realizing how little you know is always a humbling experience, but then being able to grow as a clinician, seeing your work improve, having more predictable results is always quite rewarding.
So what you're saying is, you were probably, would I be wrong in saying that earlier on you were doing all these maybe composite weekend kind of courses and all that kind of stuff, and then they were giving you tips and tricks along the way, but it wasn't until you kind of dived into this you could kind of really see or get more predictable results, whereas before it really wasn't?
Absolutely. Being able to begin with the end in mind is something that only a comprehensive course can teach you.
So, I mean, your goal is to be an aesthetic, and you started off trying to be a full mouth. So, would you say this is kind of how you imagined the path to take, going through surgical to kind of get through the emergency kind of cases, going through the ortho to learn about occlusion in the full mouth kind of situation, and then kind of getting into the cosmetic side of things to achieving that goal of being a full mouth rehab, or has that slightly changed a little bit?
You're spot on there, as in, and this is what this is the same advice that I gave to one of my best friends who's specializing in the US right now. Always have a map, right? So my map was, soon as I got my license, as soon as I started practicing, to get the basics down first, right? So surgical extractions, at least being able to diagnose ortho comprehensively, relatively decent endo and all that. So get your basics down first, and then before you invest in more complex CPD, go learn communication, go learn management, go learn influencing your staff, your patients, and then come around to more complex, more comprehensive cases and CPD. Because there's no point in investing heavily in really expensive courses at the beginning of your career when you can't convert cases, when you don't even know if the practice where you're working is where you will be working, 5 years' time.
I mean, talking about communication and, converting cases, you've actually done some communication courses. Was it with Dr. Shah?
That's right. So I've done communication courses with Kinar, of course, Mark Hassett. I've done all of Prime's courses, all of them as well. And probably some others that also Lincoln Harris, rapid efficient treatment planning. But then Kinar's have been quite helpful because just like Jeff, Jeff might have mentioned, Kinar offers a full comprehensive system of treatment, and it's not just communication with him, it's reading people, right? So being able to know what motivates people, being able to know and understand what someone's fears are, being able to understand how someone makes a decision is more important than just using, a language pattern that can influence someone.
Right. So can you dive into that a little bit more? Because some of our listeners are probably wondering what you're trying to say, but not really saying.
Exactly. So Jeff touched on this as well, right? And it sounds like a little bit of hocus pocus, but then when you go to communication courses, most communication courses will teach you language patterns or specific words that you can use and all that, right? But none of that matters unless you really understand what motivates someone, right? So the whole NLP thing, and it's, I can't really dive into all of that because it's quite a massive pool there.
Yes.
But to summarize, people who use NLP, so neuro linguistic programming, Tony Robbins, Barack Obama, Oprah, right? So we know that all these people really know how to bring out emotions when they talk, and that's something if you can do as a clinician, as a business owner. It's not just for your patients, right? Communication is something you use on your staff as well. Mm-hmm. How do you build connections? How do you build rapport across cultures, across educational differences, across financial differences?
Yes.
So being able to understand people, being able to understand the differences in people, being able to understand what motivates people, what drives them, is more important than just using language or words. Mm-hmm. And that's what NLP is. That's what a comprehensive communication program should cover for you. I hope that makes sense. I hope that's clearer.
Yeah, definitely. I think. Thank you for diving into that a little bit more, because a lot of people, I say graduates especially, they hear communication. I got to get into that early. But sometimes it's they don't know what they're kind of trying to get out of it. It's just like, am I just picking up some tips and tricks? Like, what's the philosophy? Is what you're trying to say? You need to get out of it.
Absolutely.
So as a clinician as well, we all reach a point where we might want to contemplate about, practice ownership, being a specialist or being a super GP or even starting a family. Can you share your thoughts on that?
So I'll start with the first one, ownership, right? Now Neil Kashyap talks about this all the time. So ownership may not be for everyone, right? And at the same time, most of us believe that that's the next step. Once you've been practicing for some time, you should own a practice. The one thing you really need to know, one thing that people really need to know is, of course, if you are earning more than a certain amount annually as an associate, getting into ownership would actually be a bad idea, would be a really bad decision. You'd end up losing money unless you get into a practice which is genuinely productive, right? So if you're an associate, if you're a high producing associate, buying a single chair or a 2-chair practice, getting into something like that is actually not a good idea unless you really don't like working with other people. Unless the only reason you want to get a practice is so you can work by yourself, so you don't have a boss.
Yeah.
Specializing, of course, if you really love a subject, get into it. Don't get into it for money, I believe. If you love an area of dentistry, definitely get into it. Same thing, super GP, right? If you love being able to do multiple things, get into that. And family, if you really want that, the one thing one needs to know, the thing that you need to ask yourself is what makes you happy, what you really want. Following the herd, running the rat race, it makes a lot of people really unhappy, right? We see that all the time these days, especially now when people have had to live with their choices in lockdown.
Yeah. And how's that? And is that something that you kind of went through, that kind of thought process when it came down to your situation?
Absolutely. I always wanted to be an owner, right? Because that's what you dream. Once you've hit a certain level of experience, you want to be a practice owner. But I was lucky that I got to manage practices for primary dental and for Bupa. And that gave me sort of an ownership experience without risking my own money. I had an easy out, and I kid you not, I used to have a full head of hair before I got into ownership. Management. Yeah. In the first 6 months or 9 months of practice management, I lost all my hair. So yeah, it's not for everyone. If you want to get into ownership, do the right courses, learn management, right? Don't just buy a practice and try and wing it. That's never going to work.
Yeah. And I guess you could say that, after getting out of it, the hair's all growing back now, hey?
Partly, yeah.
Right. Yeah. Well, let's talk about that. So, you got to see you went through the experience of being a DA, you went through the experience of being a receptionist, then to corporate practice management. Can you explain a little bit more about what you just talked about in terms of what you kind of saw? Because some people think about they want to know a little bit more about that because they don't know, because they're only, as an associate, you're just working as a clinician, and then on the outside it looks like everything's all, it can't be too difficult as much as you might hear about it, but what you're saying is it's very difficult.
Most new owners will realize this within the first year or two of ownership, which is why these days we have owners, who don't have the ego, who admit that ownership is difficult and go back to being associates. There's a growing number of people who do that, right? Now, to summarize, working by yourself is easy. Getting someone else to work for you is very, very challenging. Mm-hmm. Staffing issues, HR issues, marketing, because gone are the days when you open up a building and people walk in, right? Especially in really saturated markets like Sydney and Melbourne. If you're going to be an owner, you need to have done your research, you need the right location, you need to find a market that suits you, you need to be really on top of marketing, and I can't stress this enough, right? I mean, once again, Jeff, Kinnar, these guys are on top of the marketing, and their practices are growing even in really competitive areas. But as an associate, hardly anyone is aware of what these things even are, right? Do you know how your Google AdWords work? Do you know how the whole SEO thing works? Do you know how websites work? Do you know how a patient picks you as a dentist? How does a patient's journey begin, right? So it's a 7-step journey. Someone looks you up online. After having heard of you, they reach your website, they reach a specific landing page that you designed specifically for them. And I won't bore you with details, but how many associates have thought of that, right? And unless you're on top of all of those things, buying a practice in Sydney or Melbourne, and especially buying a small 1 or 2 chair practice, which isn't even going to produce more than what you would earn as an associate, right? So you're buying into all this headache without actually making any more money out of it, without actually getting any more satisfaction out of it. More likely, you're just going to burn out, stop enjoying dentistry, and just work towards paying the bills.
Right. Yeah. Fair enough. So, yeah, I mean, talking about struggles, have there been any particular struggles on your CPD or dental journey? Because I know, like you mentioned, you came from India, and then you obviously had to go through the ADC to kind of get through. And we all know that, well, not all of us, but, we've all heard the stories about how that's not an easy journey.
So the exams themselves were relatively, I found them not very challenging. Paying the fees for the exams, that's the challenging part. But everyone's got some sort of challenges with that. Wasn't the most fun part of my life. Wouldn't want to go back there. But at the same time, I was really lucky. I was really blessed that I met a lot of amazing people that really helped me along the journey. Right. So there was Mark Salakis, who's one of the clinical directors for Bupa. I used to work as his assistant, and he encouraged me to take my exams. He convinced me that I would make a decent dentist someday. There's Dr. George Lee and his partner, who were one of the first directors for Bupa as well, for Dental Corp when it used to be. They took me in as family. They helped me out. They mentored me. They trained me.
Wow.
Even when I was doing my final exams, my boss in Western Australia, who's a UWA grad, he bought me my first pair of loops, right? So,
wow.
I mean, exactly. And so, as unpleasant as that time may have been, I made friends, who became family, people who helped me out then, and people who mean the world to me, right? Because it's in those situations that you realize who's your real friend.
Yeah, I guess when times are tough, who's going to reach out and kind of get you through those hurdles?
Exactly.
Yeah. Well, talk to me about that. I mean, talk to me about that mindset, you're in at that time, because you said it was a tough time. The exams itself, you're saying, was not that difficult, but it was, when it came down to the fees and all that kind of stuff. Talk to me about that.
So the exams themselves. Now, I'm not sure if a lot of your readers have actually, viewers have actually gone through those exams themselves, but it is an interesting system here in Australia. A lot of us, local grads, overseas grads, people who've been practicing for some time, people who are on the ADA, do believe that a system like the US would be better, where international dentists come in and do a bridging course or a condensed course, right? So I think I ended up spending, between preparing for the exams, the actual exam fees, setup, and courses, about $35,000 to $50,000 over a few years.
Yeah, and you're saying that's obviously not that's a lot of money, and most graduates
on a dental assistant's income, on a dental assistant's pay, that's not that's not fun. Yeah. Like I said, I was really lucky. I met, I was working with some amazing dentists who were not only good dentists, but who really helped me out.
Yeah, because I mean, like you said, it's not easy having that much amount of money to pay for on a dental assisting kind of income. Yeah. That's probably something in your mind that that's weighing heavy on you. Do you kind of continue pursuing it? Do you kind of just give it up? Because I know, like you said, it's a big hurdle. And you said that the people around you were kind of like, no, you got to push through. It's the right thing to do. It's gonna be the light at the end of the tunnel.
The thing is, for most people, there is no light at the end of the tunnel, right? Because if you fail your final exams, it's absolutely nothing, doesn't count for anything. So either you make it all the way, or you go back to assisting or doing something else completely, because half a pass doesn't get you anything, right? So for, I believe, about 80% of people who take these exams, there is no light at the end of the tunnel. All their efforts go to waste, because at the best of times, the exam has anything between a 5% to a 20% pass rate.
Right. Yeah. So, I mean, talking about those tough times, I've heard a story where you one time forgot your train pass at your place, and then you needed some money to actually get to work, but the train trip was quite expensive or something, and I don't know. Can you tell me the rest of that story?
So that one. So back then, I used to work for a really well-known cosmetic dentist slash prosthodontist in Sydney, and I was on, because international student and all that, $175 a week, which if you're living in Sydney and paying rent in Sydney, that doesn't cover much, right? So getting to work, I got locked out of my apartment, and then I could wait for my housemates to return and let me in, but then I'd miss work, and then missing work, if you're making $175 a week, you can't afford to miss work, right? So there was this guy who was, so this is when I was, so there was this guy who was a recently graduated dental technician who I knew from, TAFE, because I was studying to be a dental technician as well. And he lent me $30. Now, of course, back then I didn't even have $30 in my bank account at all in the entire world, right? And this guy didn't expect anything. He'd been through the same struggle as his wife studied dentistry, and he studied dental technology. He'd been an international student as well, and he just gave that money to me. And obviously that meant more to me than anything else I had in this world, because I didn't even have $30 altogether, and he gave me $30. And it wasn't about the money as such, but that was just the kindness, right? Just the gesture. Someone wants to help you out just because they've been through a hard time themselves.
Wow, what an amazing story. So fast forward, you're accredited now. Now you're a dentist and that can practice in Australia, and you're in a very saturated market but Sydney. You've got Melbourne. These are very saturated markets. But then, can you share your thoughts on that? Because you work between different practices now, or you've had to move in some cases as well.
Now, saturated markets, yes. Now, markets can be saturated, but if you get into the right marketing circles, if you learn marketing properly, if you learn how to manage practices properly, that is a code that can still be cracked. It's not an easy code to crack, but a lot of people in my close friend circle do it over and over. They thrive in these high pressure environments, highly competitive environment. Uh, and at the same time, if you want to build a practice, aesthetic practice, then you need to be in a metro area, right? Now, for myself, I've done both. And the freedom you get by not yet being an owner, by being an associate, is lockdown hits Melbourne, you can always go rural. Now, rural practice is satisfying as well, but then most clinicians need to work out what sort of environment they want to work in, what sort of areas they want to work in as well, right? Now, if you're doing cosmetic, aesthetic, restorative work, rural markets might not be the best for that.
Mm-hmm. So talk to me about that, because you work in a metro and a rural clinic, and they're quite far away from each other.
So when I moved to Australia, I made this decision, right? That if to be the kind of person that I want to be, if I need to go to the darkest corners of hell to be the kind of dentist I want to be, I'll do that. Mm-hmm. Now, driving an hour and a half is much more pleasant than going to the darkest corners of hell, especially if you get to work in a really positive environment, right? So regional practices that are doing well, or even metro practices that are doing well, finding the right kind of practice, the right kind of working environment is a lot more important to me than the location of the practice, right? Mm-hmm. So by working in Ballarat, I get to play with all the toys that I can ask for, get to use the best materials that I can imagine. And I read a paper, a new technique comes out, we can, we've got the freedom to order that stuff in and just play around. Mm-hmm. And by playing around, I don't mean we experiment on real people, but if you're confident in trying something, the practice has the freedom and the resources and the patient flow to really, really grow as a clinician, right?
Yeah. Yeah. I think that's interesting that you put it into that, because like I say, a lot of our community, our listeners are probably thinking, when they're graduating, I want to just be in these particular cities, and I want to, that's where all my friends are. That's, we're all in our 20s and 30s, and everyone's in the city, and that's where it's all happening. I just want to be there. I don't want to have to travel too far away. But what you're saying is, guys, it's not about that. It's about, finding that passion in the practice. And, if you can find the right, I would say, mindset or culture within the practice that aligns with what you are about as well, that's going to take you further in your career, as opposed to maybe that short-term kind of mindset.
Absolutely, because I see a lot of fresh grads end up in jobs where they're essentially just doing hygiene work, right? Or maintenance, or maybe a filling once a week, or maybe a filling a day or something, if they're really lucky. Now, if they knew going in that they have a choice, they can either in 5 years' time be a master clinician, be known for their art, have a satisfying day at work, learn, earn, and be the kind of clinician they wanted to be when they were at uni. Or 5 years from now, struggle to get a mortgage, struggle to buy a minimum studio-sized apartment because their income hasn't grown, because they're still doing the same procedures that they did 5 years ago. What would your viewers choose?
Yeah, that's a question I guess they got to really think about themselves, and really take a hard, good look at themselves. So one thing, a lot of graduates talk about is wanting mentoring. People interpret that differently. People want to be held by the hand. Some people want to be checked over the shoulder once in a while. Some people just want to be the fly on the wall. What's your thoughts on, recent graduates looking for that mentoring when they're looking for the practices as well?
Looking for mentoring is absolutely fine. That for most fresh grads, that is a key criteria in looking for work, right? Looking for the right job. Now, the style of mentoring, I believe, may not be as important as the mentor itself, right? So finding the right mentor is more important than finding the style of mentoring. and look around, right? I mean, this is something that Jeff mentioned as well. There are some very unpleasant people in the dental industry, but as a whole, by and large, we have amazing people who love what they do, who love to talk about what they do and what they enjoy, and who are more than happy to help out, if you just reach out. A mentor might not need to be at the practice where you're working itself, right? Just reach out, find out, look up someone who's doing the kind of work that you want to do in 5 years' time. Talk to them.
Yeah.
Right? That's always going to help.
Yeah. And that's what you found when you were kind of looking to take it to that next level for your own clinical work. You just kind of went ahead and messaged them, whether it be online, and see if they would be willing to kind of take on that kind of mentoring. Sometimes that can be difficult for both the other person as well. So how would you say people might make that transition or that approach better per se? Sometimes maybe it might be providing more records or information. How do they make that asking for help easier?
I mean, with multiple ways of doing that. Records definitely help, but I believe building a relationship before you ask for help is a better idea. So most of us are nerds, right? Most of us love what we do. Most of us love talking about what we do, and most of us don't have enough people around us who have appreciate how much effort we put into doing what we do. So if someone comes along, if a student comes along who really appreciates the work and who really wants to learn, most of us are happy to help. But then, building a relationship, having that sort of comfort before someone just sends up a whole bunch of photos on social media asking what they should do next, that helps.
Yes. So basically, everyone's going to reach out to Dr. Ahmed. Please, just try to get to know him first before you try to throw him a whole bunch of images and records, because he's not going to be able to help you straight away.
Honestly, I don't believe I'm qualified enough to help someone out in that way. I mean, I'd be more than happy to in any way that I could. But then there's so many senior clinicians, there's so many masters and gurus out there who'd be much better suited than I am to mentor someone.
So, share with us where you hope your ideal clinical or non-clinical day would look like in 5 years' time, and what kind of CPD do you want to do to kind of get to that point?
Yeah, because Jeff and myself, because we've had the same mentor, Kinar, our ideal day in 5 years' time looks quite similar. So hopefully no more than 2 or 3 clinical days in a week, doing the procedures you enjoy and love. For me, that would be smile makeovers, aesthetic and restorative work, good consults, good treatment planning, and on non-clinical days, being able to mentor associates, being able to train staff, because of course, this is something associates don't realize as well. Running a successful practice requires ongoing, repetitive training and retraining of front desk and chairside staff as well. So hopefully I'll be able to do that in 5 years' time.
Right, as in like build up those systems slowly and then just kind of weave into it.
Even after you build up systems, the thing is, the fact of the dental industry is, it is a high turnover industry. People do tend to slip up, and at the same time, in addition to staff that might be new, you've got procedures that are new, right? You've got to adapt. You've got to continuously adapt to a changing market. So training and ongoing training for staff is a key part of running a successful practice.
And tell us what your non-clinical day would look like too then.
Non-clinical day would be staff training, associate training, and maybe, so same as Chris. I mean, not the same level as Chris, but I love my food as well. Maybe I'll still be around Melbourne. Maybe I'll still be able to go out, try out some new restaurants.
Yes.
maybe if it's winter and we're not in lockdown, I might be able to go to the mountains.
Where's the best Szechuan hot pot place?
Ooh, my current favorite is Panda Hot Pot. And are you from Melbourne? I'm not sure. Have you?
No, I'm from Sydney.
Thought so, yeah. So Sydney. With Sydney, one of my favorites is the Memory Tongue place. Have you been there?
I have not, but I'll definitely look it up after this.
Yeah, no. So Panda Hot Pot is one of my favorites. David's is pretty nice as well. But yeah, that's the reason I find it hard to move away from Melbourne completely, because there's so much good food.
Yes, I heard the hot pots was your jam.
Absolutely is.
So, just to wrap it all up, what would be some words of wisdom that you would like to leave for the budding young dentist who's about to graduate?
So, two things. So first up, we've all heard this. There's things that you enjoy, there's things that you're good at, and there's things that the world is ready to pay you for, right? Find out where all three meet, and you'll be a happy chappy forever, right? And secondly, most people, when they first graduate, will be making more money than they've ever made in their lives before, right? And it's very easy to get carried away, right? So when you make that kind of money, respect your money, respect your time, respect your money, use your time well, and use your money well. Don't just buy the fanciest, most expensive car you can, get a loan on. Put that money in areas where it'll grow, be it investments or be it CPD that's going to pay you and return your investment many times over in the next few years.
Mm-hmm.
Yeah, I guess that's one thing you see all the time, right? People just blow up all their money on fancy cars as soon as they graduate.
Yeah, well, I mean, but Ahmed, I can't put it on Instagram. People can't see if I put all this money away. I can't post about it. How do I share it to the people so they know I'm doing all right as a dentist?
Exactly. Yeah. So that I mean, that would really help most people. I wish I'd known all that in my first years, but then that makes a difference.
Well, Dr. Riz Ahmed, there's so many more questions I actually want to ask you, but that's all the time we have for today. If you could let the people know how they can find you or what you've got going on in your life.
Absolutely. So I've got my Facebook page and my Instagram page, and yeah, so reach out if there's anything I can help anyone with. I'm more than happy to. And if I can connect them to someone who might be better suited to help them, I'd be happy to do that as well. And so thank you for your time. It was lovely talking to you as well, Lawrence, and hopefully we'll chat soon again.
Likewise, and for our listeners, just make sure you get to know him first. Don't just throw a whole bunch of records at him. If you like this episode, drop a comment below on your favorite part, but don't forget to like and subscribe, and we'll see you in the next episode of CPD Junkie Podcast. Thank you.